All right, good afternoon. It's noon here for me. So whether it's evening or morning for you, welcome. We're going to start our CPR webinar for today. And I'm going to keep everyone muted for now. There will be a chance at the end where we can unmute and ask questions, or you can always type into the chat and I will check that after each section to see what questions there are. So please feel free to ask questions. We're going to get started. So this webinar is sponsored by the Save a Life initiative with the DISC Foundation. My name is Kim and I am a nurse. I live in the United States right outside Washington, DC, and I'm the medical educator for the DISC Foundation. The DISC Foundation was created for the sole purpose of empowering others to save lives. So we provide free healthcare education anywhere around the world. So all you have to do is just sign up and ask for it. So I do these webinars every week. And also you can just email me. And if you have a whole group of students or coworkers or friends, I can just set up a time specific for your group and discuss any healthcare education that you like, any topic, along with CPR for adults, children, and infants. So you'll see Save a Life Initiative, savealife.com, and NHCPS. Those are the groups that are sponsoring the webinar. And our goal is to empower 10 million people to learn CPR. So welcome, and I hope you learned something today. So in the United States, one of our statistics is out of 300,000 people who had a cardiac arrest in 1 year, the survival rate was only 10%. So that is not very good. In the hospital, it's a little bit higher. Out of 200,000 people, the survival rate was closer to 20%. But studies have shown, of course, that starting CPR right away when someone is unresponsive and unconscious, that can double or triple their chance of survival. So we recommend that everyone starts CPR right away if someone does collapse. The goal, along with American Heart Association, is to increase that rate closer to 40%. And people are worried about doing CPR, of course. If you've never done it before, it can be very scary. Fear of disease is very prevalent right now, of course, with our pandemic. The studies that have been done just in the year since we've been working with this pandemic have shown that our first responders are not contracting COVID-19 at any rate higher than they would in the community. So even though they are around people every day, even at work, that may have the disease, their transmission rate was about the same. So the key point here is that you do need to have your PPE, your personal protective equipment. Do not give mouth to mouth to anyone that you don't know. Like don't breathe for that person. Don't put your mouth on that person's mouth, because you will, of course, transmit any virus or disease that way. And you need to have gloves, a mask, and if you have a gown and goggles, that's even better. So you can do chest compressions only, which we'll cover in a second, which is safer if you don't have any PPE on you. In the United States and in many other countries, I have looked it up, and you can do a quick Google search to see what your country has for this law. We have a law for Good Samaritans called the Good Samaritan Law, so that it protects anyone who is attempting to help someone else, a stranger, they were in a car accident or an accident at work, and doesn't matter if you know them or not, if you attempt to help them, whether you get a good result or not, even if the person dies, you are not liable legally. You would not be, have a punishment or have to pay money. So that's a nice protection that we have here. And I do see a lot of countries have that. So you want to check that out. The rule is just that you need to perform to the level of your ability or certification. So you can't try to do some surgery that you saw on TV or something like that. But if you are trying to do chest compressions after you took your CPR certification, that's fine, you will be covered there. If you're unsure of what you're doing, I think we can take care of that by teaching you and helping you with your questions. If you're worried about hurting someone, we have to remember that if we do nothing and they're in cardiac arrest, they will not wake up back by themselves. They will die. So people would rather, maybe have a broken rib or an injury, maybe from CPR, which does happen, than doing nothing. We'll talk about the scene here next. So for our adult chain of survival, we're going to focus on these first three steps and the activation of the emergency response. That's calling your ambulance or your paramedic or your emergency number. Here in the United States, we call 911. So you just need to know who you're supposed to call in your country, or if you're at work, sometimes there's a different number if you have medical providers on staff there at work. We need to recognize that there's an emergency and perform CPR right away within 10 seconds. And if there is a defibrillator available, which hopefully there is, whether it's in a building nearby or it comes in the ambulance, we want to use that right away too. So the next three steps are dealing with our hospital providers. So we don't have to worry about those as lay providers, but once the person gets to the ER, they're going to have advanced life support, maybe even in the ambulance, and then go to a cardiac care unit and have recovery. So that does take a longer time, a few months even. CPR is cardiopulmonary resuscitation. And the cardio and pulmonary is heart and lung. So we are providing the function of the heart and the lung physically for this person because their heart and lungs are not working. So you can combine rescue breathing and chest compressions. That's most effective. If you don't have a breathing barrier or mask and you don't know the person, we don't do rescue breathing. So you would do chest compressions only. Or if you forget or you're nervous, you're just not sure how to do it, you've never done it before, chest compressions is what we want everyone to focus on, just chest compressions. So we are literally pushing down on the bone of the victim in the center of their chest, and that is squeezing the heart. It's pushing the heart. The heart's not pumping. It's not pumping on its own. So we need to physically push that down, and that will push the blood out of the heart. The blood will go around to the arms and the legs and the circulation, but our main goal, of course, is just oxygen into the brain. There's already oxygen in the blood on the hemoglobin from when they last were breathing. So rescue breathing will add a little bit more of oxygen if done effectively, but it's not crucial. They do already have oxygen in their blood, which we can circulate for them. So we want you to start CPR right away. Like I said in the beginning, it does increase the likelihood of survival, really increases that percentage. And you only have a few minutes, 4 to 6 minutes before brain damage begins. And brain damage would be inevitable after 10 minutes. So you do really only have a few minutes to get in there and get going. So we're going to go over our CPR overview for adults. And first we need to look at, is the scene safe? So you're physically looking around and trying to take 1 or 2 seconds and just take in what has happened. Was there a car accident? Did somebody fall off of a ladder? Was there a chemical? Is there violence? Was there fire? Is there electrical cord? Just what happened? Because we have to see, is that danger over? We can't run into that and grab that person if they accidentally cut an electrical wire and they're still touching it, because then you will also be in danger and go unconscious and not be able to help that person. So we want to make sure that we have a safe scene and for ourselves and the victim before we run into that situation. Next, we're going to, as we come up to them, if it's safe, check and see if they're responsive, which means, are they moving? Are they responding? If you yell their name, or otherwise we just tap really hard on the shoulder and say, hey, are you okay? And then if they do respond, even if they're mumbling, open their eyes, move around, even if they're not talking, we can call for help and wait with them. We don't have to do CPR. But the rest of this is if they are not responding. So you get no response at all. So we need to tell someone, hopefully someone else is with us, say, call for help. And here in the United States, we're going to say, call 911. And again, if you have like a work number or something like that, or you dial 0 or something, know what your emergency number is and call that and get help, because we want an ambulance. If there's an AED in the building or nearby, you can send someone else to get that so that you have that ready when it arrives. Then while someone is calling, we're going to check and see if they're breathing. We're just going to get down close to them and look and just see if the chest or stomach are moving, or the face, or feel any air. Just do your best and see if you see any breathing. If it's very occasional breathing, like a gasp every 30 seconds, that is not normal breathing. That's called agonal breathing. So we don't count that at all. We're looking for normal breathing. If we don't see breathing, we're going right to chest compressions. So we'll do 30 chest compressions, do 2 rescue breaths if you have a mask or a barrier, and continue at that rate. And we're going to go over those steps until one of these things happens, until either the AED shows up and you need to pause for a few seconds to put those pads on the chest, or until a paramedic arrives or an ambulance, or you see signs of life, which would be vomiting, seizure, just movement of the arms and legs. People are not going to just wake up and start talking to you. So you're going to have to look for a slight difference in movement. Or if the scene becomes unsafe, something has moved or crashed or become dangerous, you need to get out of there. Or if you are by yourself and you might have done CPR for like 20 minutes already, it's very, very tiring to do it by yourself. You can certainly take a break and decide if you need to stop or not. So we're going to pause there and do our first video. So just a moment. Oops. There we go.
If your initial check of a person reveals that she is responsive and awake, get consent to provide care. If she does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic sample as a tool to remember the interview questions.
So what's going on? Are you in pain? My arm really hurts. I tripped and fell.
Okay, how are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay, let me ask you a few more questions, and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay, and what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay, are you taking any medications currently?
I'm on blood pressure medication.
And when did you take it last?
This morning.
So do you have any other medical conditions?
No.
When was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It's
Okay.
a couple hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch and I tripped over a crack in the sidewalk. I'm just so clumsy.
Oh, I've been the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good. Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness. Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. Let me take a look first. Okay. Does this hurt?
No.
And this?
Mm-mm.
Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. Are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay. Does this hurt? And this?
All right, I'm going to stop there because they take another minute and just go through the whole body. So that is how to check a responsive person. And let's take a look on someone who is unresponsive. There we go. So this is what we're looking for with if we think we need to do CPR. They're obviously collapsed and not sitting in a normal position. So if we think they're unconscious, you go up and tap or shout or use their name if you know it, and check for the breathing for 5 to 10 seconds. And the gasping is not normal breathing, it is agonal breathing. So we're going to tell someone to call the emergency number and go get an AED and a first aid kit. You can gather information if you need to, but this is if they're responsive. So if they are unresponsive, that's what we're determining if they're breathing or not. Okay. So here, this person is not responding and not breathing. Then they need to be face up on a firm, flat surface. And we're going to start CPR starting with chest compressions. Right, so heading back to our overview. For hands-only CPR, which I mentioned earlier, you're going to put one hand in the center of the chest and the other one on top of it. It doesn't matter which one you do first. You just interlock your fingers like this and make sure it's flat. And then get right over top of their chest, the right center of it, right in the middle, and push hard and fast. And we can just keep doing that. You're not going to, if you don't have the barrier or mask, you're not going to stop and do 30 and 2 in that ratio. You're just going to keep going, and we can switch every 2 minutes is the best pattern that we can follow. So the placement, like I said, in the middle, we're aiming for 100 to 120 compressions a minute, and the depth goes by the depth of the chest. We're going about a third. So that means less than a half. If you're looking at someone from the side, this is a person laying on the ground, and I'm pushing on the top of their chest. I don't want to go halfway down. I want to go less than that. So up like this. And of course, children, it's going to be much smaller. And infants, we just use like 2 fingers because they're very small, of course. They need to be on a firm, flat surface, and we're always keeping our interruptions less than 10 seconds. So if we're checking for breathing, or we're putting AED pads on, or we're switching providers, anything that would interrupt the chest compressions, we need to keep that down. So for our rescue breaths, we're going to open the airway first, and I'm going to show you a video with these in it. And if you have a mask, you're going to do a tight seal and use the pocket mask, which you blow into. Bag mask is what the ambulance would have, where you squeeze the bag. And we also can just get a basic plastic barrier, which you'll see in the video. 2 breaths, each lasting 1 second, and watch for chest rise. So after the first breath, if you don't see the chest rise and you don't think it's working, we readjust, retilt the head and neck, reposition the mask, make sure you're holding it down for a tight seal, and try the second breath. If it doesn't work a second time, that's okay. We just move on and go back to chest compressions. They might have an obstruction, or there just might be something wrong. And again, it's just not that important to focus on the rescue breaths. It adds a little bit of extra result, but it's not essential. So you can just continue with chest compressions. So let's take a look at the CPR video, and then we will go back to the AED.
Hey, are you okay?
Someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches. And for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past-neutral position. For a child, you'll only need to tilt the head to a slightly past-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4.
Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911. EMS personnel take over. You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2
Have the
and 3
AED
and
for
4
safety.
Okay, now for the AED. What is an AED? It stands for Automated External Defibrillator. Means it's automatic. It does everything for you. You just have to turn it on. It's outside of the body, external, and it's acting like the heart rhythm, that we need. So the defibrillator will actually stop the chaotic activity of the heart by shocking it, and then it allows the heart to start by itself. So all we're going to do is turn it on and follow what it says. It will talk to you out loud, and also there's pictures on the machine or even on the pads so you can tell where to put them on the chest. So you just match it up and put one on each side, one up on the right shoulder and then one down below the heart on the ribs. The only thing to really pay attention to is what size pads. There's 2 size pads. There's pediatric, and those are smaller, and they're for the age of under 8 or under 55 pounds or under 25 kilograms. So that's a very small child, like a toddler, elementary school. Anyone bigger than that is going to get the adult pads. So we're going to take a look at the AED video.
For someone in cardiac arrest, calling 911 or the designated emergency number, starting CPR immediately, and using an AED as soon as possible gives the person the best chance for survival. Cardiac arrest can occur when the electrical impulses that cause the heart to contract rhythmically become abnormal, disorganized, and chaotic. The heart will stop beating or beat too ineffectively to circulate blood to the brain and other vital organs. Two abnormal heart rhythms in particular, ventricular fibrillation and ventricular tachycardia, can often be corrected by defibrillation, the electrical shock delivered by an AED. When effective, the shock disrupts the abnormal electrical activity long enough to allow the heart to spontaneously develop an effective rhythm on its own. An AED is simple to use. The device will guide you every step of the way. AEDs can be used on people of all ages and can also be used on pregnant women. All you need to do is turn the device on and follow the voice and visual prompts. Remember, start CPR immediately and use an AED as soon as possible. For each minute that CPR and AED use are delayed, the person's chance of survival is reduced by about 10%.
All right. I don't see any questions yet. Let me look in the chat. Where did it go? Oh, here it is. One question. Should I stop compressions if the victim gasps? No, no. So the gasping is going to look very abnormal. I think of it like a fish gasping for air, like going like a really big open mouth. When people breathe, even if you're snoring or have a respiratory problem, you know, you don't see much movement up here at the mouth. So you'll see like a lot of movement, and it just won't look normal. It'll be very obvious. And if you hear a big sound too, like that, you know, kind of gasping for air, that's not normal either. Also, we're looking at the frequency. We breathe as adults like 12 to 20 respirations a minute, which is every 5 to 6 seconds. So you kind of can take that 5 seconds and look, and if we see a big gasp, you can take 5 seconds. And then if there is not another breath in that 5 seconds, then ignore that and just keep going with the chest compressions, okay? So for choking, you will see someone coughing or grabbing for their neck, or, you know, maybe being able to speak or yell. So if we hear any noise at all, whether it's coughing or squeaking or speaking, that means they are getting some air. So their airway is not completely closed off with an obstruction. So we encourage them to keep coughing. You can call for an ambulance, you can stay with them, talk to them, reassure them, but we don't have to intervene at that moment. Once they stop making noise, so they're going and then go, you know, they're still conscious but not making noise, then they are choking and they can't breathe anymore. So you don't have much time now. Then we do abdominal thrusts for adults. So you'll see that in the video here. With infants, since they're small enough to flip back and forth, we can hold them. We can add the back slaps for infants, but that's not recommended for adults since they're upright. It works best if you have the infant with their head down so that gravity helps also.
Let the choking victim know you're going to help them. Wrap your arms around the victim and make a fist with one hand and place it above the navel in the middle of the belly. Hold the fist with your other hand and press forcefully into the person's abdomen and up toward the chest. Continue performing abdominal thrusts until the obstruction is removed or the victim becomes unconscious. If the victim becomes unconscious, lower them to the ground and begin CPR.
So here is the overview of everything that we just briefly went over, and then we're going to take a look at the bone injuries next. So chest compressions, there's all the numbers, but I really want you to remember 30 and 2 for adults. And AED, you want to remember just turn it on first. Get one and turn it on, and it will tell you what to do. With rescue breaths, if you have one of the masks or or a barrier, plastic barrier, you can do that so that you don't have any transmission of disease. Or if it's your loved one, family member, somebody you know, and you're very confident about, their health status, you can certainly decide to do mouth to mouth, but you're running the risk of transmission of any virus or disease at that point. That's your decision. Otherwise, we just do chest compressions only if you don't have a mask or barrier. For choking, if they're making any kind of noise, we just encourage them to keep coughing. If they then become unable to speak or cough, but they're still conscious, we can do the abdominal thrust. You put your arms around to the front when you get behind them, and they can even be seated in a chair. And then if at any time they become unconscious, they kind of collapse in your arms, you lower them to the ground and you start CPR with chest compressions. And we skip all that beginning part because you've already done it. So you know that they have an obstruction. So you're going to just go to chest compressions. All right, so we're going to take a look at the musculoskeletal next. So this is muscle, bone, and joint injuries. So someone says they fell and they got hurt, something happened. So there has to be a mechanism of injury. There has to be a reason that could have caused a significant injury. So with small children, you have to kind of figure that out. They just run into a couch and it was soft, then probably nothing happened. But if they fell off of some playground equipment, like this picture, and fell a few feet, then yeah, they could have broken a bone. So you have to think about what happened. Do they have pain, swelling, immediate bruising, purple, blue, and they don't want to move it? Then we don't have them move it, but those are the signs that something can be wrong. Of course, if it doesn't look normal, it's bent, deformed, crooked, you just leave everything the way it is. If a person tells you they felt or heard a sound, that's very popular with our joints, the knees, the shoulders, the fingers. So if they were doing some gymnastics or soccer, and then they're like, oh, my knee just popped and now I can't move it, then usually that means something significant has happened. So, of course, if a broken bone is protruding through the skin, that's called a compound fracture. Don't touch it. Um, and those are the other things that we said. So, if you see any of these conditions, then you're going to get them to the hospital. So, whether you call the ambulance and have someone come there, or if it's, their arm and they're able to walk and get in a car and go with you to the hospital, it's not life threatening if they've broken their wrist, but they need to get to the hospital so you can get an x-ray and get the bones set. So if they are trying to move and you hear a sound or it's hanging, we don't want to move. And so these are just basically saying these are the instances where we would have the ambulance come to us. If they cannot move, like if you break your hand in a door, which I've done, you can get in the car and go with someone to the hospital. If it's your lower body and you can't walk, you can't get in a car, or if it's the head, neck, or spine, having trouble breathing, or they can't feel that part of the body, or it's cold, like if you say, can you wiggle your toes? Then we're just not going to move them at all. They need to have someone come to them. Okay. If they have signs of shock, we're not going to move them. And that's when your blood pressure drops. So they could be cold and clammy and be dizzy, feel like they're going to pass out, vomit. They just feel really sick all of a sudden. Our severe bone injuries will definitely send people into shock. If they're not already laying down, you just want to have them lay down on their back if they haven't had any injury to their back or neck. And then you can even put the feet up again if it's not going to do anything to their injury. If you think they have multiple injuries, so definitely looking at that mechanism of injury, like a car accident or a big fall off of, a one-story building or something, we're not going to move them at all. So if they can safely and comfortably get in a car without further injuring themselves, then you can do that. If it's more serious than that, then you need to call the ambulance. So general first aid care is the same, and we're just having those few minutes basically waiting either for help to come to us, or hopefully it's only 10-15 minutes to get to a hospital. So they don't need to move or straighten anything that hurts. Like if they're holding their arm like this, they can just keep holding it like that. And when I help people that have accidents, and I work at sporting events as a medic, and they're saying, my shoulder, I can't move it, or my leg or whatever, and they're holding it like this, I just bind them in that position. So I keep those triangle bandages and ace bandages in my first aid kit, and I'm just going to like wrap their whole body in this position. If wherever a person is holding it that's comfortable for them is where they're going to hold it, and we don't move them, and not until you get to a physician that is going to do the x-ray and then try to set that bone. If you have ice, I will also put ice packs on people. So I'll bind them first, and then I do big ice packs, and I have that saran wrap roller, and I can just like saran wrap ice onto a person, and that's that plastic cling wrap. That's the brand name, the saran wrap. And we don't move it. You don't need to splint anything. We used to do that more decades ago, but now with it being, 10-15 minutes till we're going to get to a hospital, we don't really need to do anything to it. We would only splint someone if we had to move them, like, and their bone was obviously deformed or hanging or something like that, and you couldn't move them without causing further injury, then we just use like cardboard or magazines. It's really not even anything that fancy. And then we would wrap both sides of the injury, but you don't touch the middle where the injury is. And just to give it a little more support, if you do have like a leg and you have to move the person because of a fire or something like that. But generally not, we're not going to splint the person. And this is what we're doing now for all injuries. It doesn't matter if it's just a child who thinks they twisted their ankle, or if, we really think somebody broke their wrist. If they need to get to a doctor, we're going to wrap them up and get them there, rest, ice, the cold, immobilize, don't move, and then elevate. So then we also do this at home. So this is saying if we're going to do this to get them to the hospital, but also if it's mild and we don't think it's broken and they don't need to go to a doctor today, then we will say, if a child gets injured at school, okay, you're going to go home. Don't use this part of your body that hurts. Immobilize means stabilize it. So you can use the ACE wrap, the elastic bandage, or if they think they hurt a finger, you can put a little finger splint on. So just there's different bandages made for the different parts of the bodies that you can get in the drugstores. And then the cold is like ice on a cold pack. I'll suggest 20 minutes, an hour if it continues to hurt. So not having it on all the time, but putting it on for like 20 minutes and then taking it off. And then we don't put the ice pack directly on the skin. I'm going to wrap it in a towel, like a kitchen towel, or even put an ice pack in like a clean sock. That works really well, and just put that on the area. And then elevate. If your arm hurts, you can just lay and put it up on a pillow. You'll find that the bone injuries, like if you did break a bone, one way to tell is if it is hanging down, like your arm's just at your side and it's really throbbing with your pulse, that's more a sign that you need to go to the doctor, that something is really wrong there. So again, we use this RICE acronym, and rest, immobilize, cold, elevate. And then basically, if it's not feeling better each day, like, or it ever gets worse or becomes very purple or swollen or numb, then you just change your mind and you go to the doctor. So that's very easy to do. All right, and then you will get an email from me after this, and you can respond to that if you have any questions. But now I am going to show you our website and how to get the course if you haven't already done so. So you're going to go to the savealife.com, which is sponsored by NHCPS, and I'm going to put the web address in here into the chat. And then let me answer this question. I see 2 more questions in here. Okay, so after someone regains full consciousness, it says, do you give him water or send them to the hospital? Basically, if you are not sure what is going on, like you don't know what happened or why they passed out or why they are unconscious, they need to see a doctor. So they need to go to the hospital. We're not going to give people water. We generally don't, because they might throw up. You don't know what happened. Sometimes if people do need to go into surgery right away, they're not supposed to have anything to eat or drink for 4 to 6 hours ahead of time. So that can mess up them having surgery. Like if they did have a heart attack and were in cardiac arrest and they do manage to wake up and sit up, they need to go to the hospital. So someone that has been unconscious, unless you absolutely know like that they were diabetic and had a diabetic emergency, or they have epilepsy, like they know that this is something normal for them to pass out, then they need to go to the hospital, because you don't want it to be your decision. You want a doctor to decide if they're okay. And then the next question, if there's need of immediate removal of the victim of a scene, should you move them? Yes. So if you come across a car accident and the person needs CPR and you have to pull them out carefully and put them on the ground and you're doing CPR, and then the car catches on fire because the gas was leaking, yeah, you have to move. So we don't, you need to run away. But of course, then the next important thing is, can you drag that person? And you just try to grab them by their shoulders, by their clothes, and just pull them all in one unit. And 2 people trying to pull someone is better than 1. And of course, you just have to make that decision in the moment. Like if you're rescuing someone that was in like a construction accident and then more things start falling, you have to get out of there. So yes, you should move them. Yeah. And that's what we say about the scene being safe. If it's safe for you to go in and for the victim, then you can go work on that person. If it's not safe, but there's still a victim in there, you need to just call for help and get the firefighters there so they can get the scene safe, and then they'll assist the person. So we can't always help everything. But you're going to do the best that you can. Here, I just realized I didn't put that in there correctly. So there is the NHCPS, the website that you're going to go to. It's National Healthcare Provider Solutions, and the Save a Life, and then click that you need CPR. Thank you, Florin. I see the note there. Someone did that. Yeah. The person might ask for water. I don't think I would give it to them, because I know that they need to go to the hospital and they're not supposed to eat or drink. So, but if someone's choking and then they throw up the food that they were choking on, most times people want to drink something because they want to clear that feeling in their throat. But any other thing that's unconscious, I would not give the person water. All right, so you're going to put your CPR in your cart, and I want to just show you how to put the code in. They already have the code in here from the last time I did this. So it's normally 59, and you come down here to click here to enter your code, and you're going to do the DF CPR Web 100, and I'm going to put that in the chat. So DF is Disc Foundation, CPR Web 100. So you put that in here, and then it's going to be 0. And then I want to show you some of the other resources that we have on here. So this is how you get certified. You can look up, watch this video and see who is NHCPS and Save a Life and why they're doing this initiative. But you enroll, you go through the course, take the exam. You can take it as many times as you need to pass. You need to have an 80% to pass. You can also save your progress and come back later so you can log in and out. You don't have to do it all at one time. And then after you pass, you get instant access to download and print the card or certificate. That is free. So you can download it, print it out. You can email that if you need one for work or school. If you want a printed card mailed to you, which is like a little paper card, that costs a few dollars for shipping. And so they have a screen where you can request that. So to look at the course, let me show you. Here are the categories, and we've gone over some adult CPR, AED, and choking, and also a little bit of the traumatic injury section. So there's all these different sections, there's videos with each one, and then you take your exam at the end. Please also look at these free resources. We have the other courses. If you are a medical provider, then you can also take BLS, PALS, or ACLS. There's practice tests, mega codes, algorithms. And please take a look at this mobile app. This is free and you can get it on your app store called MediCode. And it does have all of the courses and it's a great app. It has all the algorithms. You can look something up in an emergency or you're saying first aid, what do I do for a burn? You can look that up and have it all there with you. And then also we have ebooks that you can download. These are all 50 to 100 pages that we wrote. And you can keep one on your computer, or if you need to print one out to have as a reference, these are also great. So that is everything I wanted to show you. Are there any other questions I can help you with today? Okay, thank you so much for attending. You are going to get an email in the next hour to show that you have attended, so you can use that for your certificate if you need one. And also go ahead and take the course if you haven't already done that. And then when you pass the test, you will be CPR certified, and that is good for 2 years. And you are welcome to sign up for more webinars on the Calendly website. I do different topics each week. And I just hope you have a good day. Thank you. Bye-bye.
Thank you so much.